Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenters are Dr. Stephen Zonner and Sharmi Mukherjee. Dr. Zonner earned his medical degree at Midwestern University before completing his family medicine residency at Bodsford General Hospital. He completed his fellowship at Rush Presbyterian St. Luke's Medical Center. Dr. Zonner is board certified with the American Osteopathic Association. He is also a member of the Washington Township Medical Foundation. Sharmi Mukherjee graduated with her bachelor's in physical therapy from India. She completed her master's in physical therapy from Loma Linda University and earned a doctorate of physical therapy from Northeastern University. Sharmi is certified in vestibular rehabilitation by the American Institute of Balance and has been working with patients with dizziness, vertigo, and post-concussion problems. She has been a practicing physical therapist in the U.S. since 2007.
Really want to thank you all for coming tonight. Appreciate it. We're going to be talking about some very interesting topics tonight. I think all of us are interested in exercise in some way. And tonight's talk is exercise and injuries. Are they preventable? Now, some of us might think that we'd like to have exercise be preventable because we just don't want to do it. On the other hand, injuries are one thing that once you get started in your exercise, it ends up derailing you from what your goals are. The other side of it, the flip side of it, is when we go too little. You can read that. It says, I've got to start taking care of myself. Whoever was supposed to be doing it has done a really bad job. Well, sitting is now considered the new smoking. Inactivity is the big deal these days. And as you can see on the left, that you have a 2 times greater risk of diabetes just sitting around. Matter of fact, I just read something today that said that your risk of diabetes goes up 22% every hour you don't exercise. I mean, I don't know how they quantify these things, but I think they're just obviously trying to scare us. And the reality is, inactivity will lead to these kinds of problems, particularly if you have a genetic risk. You have a 90% risk of cardiovascular diseases, and almost 50% greater risk of all causes of mortality. So, I mean, you know, the bottom line is we know that smoking is not good for you, right? Well, we finally got the message. It took a while there. But now we're recognizing that being inactive is not good. And I think we all basically know this. But what I'm going to try tonight is to give you an understanding of how muscles work and give you a little bit of a motivational impetus so you might consider doing exercise if you're not doing it now. This is a great meme. I love this because I tell this to my patients all the time. Doctor is talking to a patient holding up a model of the heart, and he says, so you have 2 choices. We could perform triple bypass surgery where we take a vein out of your thigh, open up your chest so we can sew the vein onto your coronary artery. This costs more than $100,000 and will keep you laid up for at least 2 months. Or we could put you on a vegan diet. The patient says, a vegan diet? Gee, doc, that sounds pretty extreme. I think a lot of us wish that magically we could, get the benefits of exercise. I mean, in fact, would you take a pill that would give you more energy, increase your longevity, help you sleep better, lower your blood pressure, prevent diabetes, raise your HDL and lower your LDL? For you dyslexics out there, is the HDL my good cholesterol or my bad cholesterol? HDL is your good cholesterol. You want that one higher. And LDL is your quote-unquote bad one. Yeah. Prevent osteoporosis, improve immunity, enhance libido? Wow. All that with one pill? Would you take it? Yeah, I think we all would in a heartbeat. I mean, and if any of the companies could actually harness that, they'd make a lot of money. But that's what exercise does, without any side effects. Except for what we're talking about tonight, is injury. So what we want to help you learn is how you can exercise and not have injury. We all have New Year's resolutions, and we recognize that about half of us, we will make a New Year's resolution. About 66% of those people that make resolutions actually do accomplish something. But you can see, really 8% are really successful overall. I mean, really stick to what they started with. It's tough. Discipline is not easy to do. But you're also 10 times more likely to succeed if you make that resolution more explicit. You share it with someone else. You write it down. You put it in a calendar and you actually pencil it in. You actually have a meeting with your doctor and tell him you want to meet him every 4 weeks so you'll stay on track. That kind of accountability will help. A good resolution will do, it will create a positive exercise feedback loop. And my suggestion to you for your New Year's resolution is this very first one here. If you can't get a lot, get a little. And that's a great axiom for life in general, right? I mean, you may not have time for family sometimes, which is a shame, but gosh, try to squeeze it in. Exercise, a little bit goes a long way. The American College of Sports Medicine has a very, very rigorous suggestion that you exercise at least 30 minutes 5 times a week. Let me tell you, I'm sure if you're like most of us and the busy schedules that we have, you need sleep as well, somewhere in there. And getting 30 minutes a day, usually by the time my Friday rolls around, I'm pretty beat. I'm ready for the weekend. So if you do something a little bit, you're going to reduce your risk of excessive soreness and injury. And one thing I wanted to point out here is you have something called macro versus micro. This is just the way we think in sports medicine terms. Macro means that you twisted your ankle. Something, sudden occurred. Micro means a repetitive injury, one that you did over and over again and it got sore and you're not really sure how it started. And the macro injuries are very obvious. The micro injuries are the ones that we're trying to prevent here, talking about. So the certain stretches and activities that you can do, warming up, which we'll talk about, will help you prevent injury. But the most important thing to remember is start off slow. If you can't get a lot, get a little. Now, this is a picture of the human body, but this is basically to give you an understanding of how muscles move. Once you understand how muscles move, you will have a better idea of how to perform stretches. Stretches are not very difficult, but for some reason we don't do them. And if you do them right, they should feel good. Maybe a little bit of discomfort in the beginning, but if you do it right and you hold it. The old method that we used to do, many of us I can see getting a gauge here on age, would do stretching in what they call the ballistic or the bouncing method. And that bouncing method is going to cause micro tearing. So when you do a stretch, you want to do it long and slow and hold it and then breathe into it and go a little bit further. That's in general how you do the stretch. But back to muscle movement, the anterior part of the body, this is the anterior, this would be the posterior. The anterior part of the body is for locomotion. It's the part of the body that provides power. And obviously this is an oversimplification, but it's in general quite true. It provides the power. The posterior, or the back part of the body, controls our movement and slows it down and provides a counter force, like a slingshot. If you had a slingshot and you hold it in your arm and you pull back, the rubber band would be the anterior part or the flexor muscle, and your force of the wrist and the arm pushing out would be the extensors, providing a counter force. It's a little complex to think about, but that's about as simplified as I could make it. So again, reviewing, the front of the body is for providing power. The back of the body is where you control that power and control motion. The hamstrings, the calves, the neck muscles, the back, the upper back, the triceps. There are three ways muscles contract. The first way is concentrically. Concentric is the medical term, but basically what it means is that the muscle is shortening as it contracts. So in concentric, the front of the body, the power, the locomotion, the muscle is contracting as it shortens. Isometric or isotonic means that muscle stays the same length. So that would be like you're holding a bag of groceries and you're walking in from the store and can't wait to put that down. That's that feeling of isometric. Or if you're sitting against a wall, and have you ever done wall sits where you're trying to strengthen your quadriceps? That's an isometric or isotonic exercise. The last, and this one we'll talk about, is the eccentric. This is the one, the way I remember this is, it's the way the muscle doesn't like to work. It's like your eccentric uncle or whoever you have in the family just doesn't do things the way everybody else does them, okay? So the eccentric muscles elongate as they lengthen and contract. Now that sounds strange, right? How can a muscle get longer and contract? Well, if you think about that, that's how it gets injured. That's where muscle soreness comes in, and we'll talk about that. So the eccentric muscle contraction is one that is done primarily by the back or the posterior part of the body. And most of us treat the fronts of our bodies like Cadillacs and the backs like a Volkswagen. We all want to look good. We want to have great pecs. We want to have great biceps. And how many times have you had an old trainer or a PE teacher tell you to do that push-up slow or do that bicep curl slow, let it down slowly? The reason for that is you want to work on the eccentric loading. So let's just think about this. If I'm having a weight in my arm and I'm letting my arm down slowly, my bicep muscle is contracting, but it's also lengthening. And those kinds of exercises, if you do them, let's say lunges is another one. If anybody's done lunges, those will get you real sore real fast because you're working on eccentric loading. Delayed onset muscle soreness is what we're talking about here. It's a medical term. It's greatest about the second day after exercise. And it is not due to lactic acid buildup. That used to be what we were taught, right? Oh, you worked out real hard, you just didn't flush out the lactic acid. It's now recognized to be due to the soreness of the eccentric muscles. And as we just finished saying, right, the body likes to do everything concentrically. It doesn't necessarily concentrate on the eccentric. So when you think about doing your exercise program, think about doing it slowly, but also recognizing that you're going to be more sore because of that. And we'll talk about how to, some strategies to combat that. Now this is one you could lay in an ice tub. A lot of athletes do that. This man does not look like he's enjoying it very much. But ice is probably the most effective and safest anti-inflammatory or way of preventing soreness. Now, I don't recommend everybody doing this. I think most of you would recognize that you probably wouldn't have a tub that big, and I'd probably get sued if I told you to do it because somebody would have some kind of complication. But the main thing in your exercise program you want to avoid is that mentality of no pain, no gain. A lot of us have that, okay, I've got to go, like the American College of Sports Medicine says, I've got to go 30 minutes, 5 days a week. And, and then by the end of the first week, or even the first 3 days, you're so sore, you don't want to do it anymore. And remember, we talked about a feedback loop. You want a positive feedback loop. So I'm recommending, going back to if you can't get a lot, get a little, do 15 minutes, serious, 15 minutes 3 days a week for 3 weeks. Odds are pretty good once you're there at the gym or once you're doing it, you're going to keep doing it. But play a little sports psychology with yourself. Just go for, say, all right, I'm just going to go for 15 minutes. And just go for 15 minutes. If you go to the gym and they see you walk in and walk out 15 minutes later, the heck with them. You know, I got what I wanted out of it. So again, as we were saying, you want to go 15 minutes 3 times a week. And again, start very slowly. Start with some brisk walking. Maybe while you're walking, use some handheld weights. You can move those around. I probably should have a slide, but I'll just verbally say this. Please check with your doctor before you begin an exercise program. You want to make sure that it is safe for you. That's probably the best thing you could do, unless you're, pretty sure you have no health concerns. But I think a lot of you I can see in here may perhaps want to do that. We're all at a good point to begin exercise. There's no age limit for when you shouldn't do exercise. I've seen articles on people starting running marathons at age 90. Now that obviously might have been somebody that had run before, but the point being, I'm sure he started off slowly. He didn't work up and just run 26 miles the first time he did it. So another strategy to prevent muscle soreness is alternating muscle groups. So that might be on your program of 3 days a week, which I would suggest you either do Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, Sunday. I like that strategy for myself because that gives you that flexibility to do either Saturday or Sunday. We're all very busy. And you could do on a Monday, let's say if we're doing Monday, you would do your upper body. Wednesday would be more cardiovascular, and then Friday would be your lower body. I mean, your creativity is unlimited, so don't hold yourself back. Most importantly, and we're going to get into this with the next speaker, is doing adequate pre and post stretching. Those are the ways that you will prevent injury. And also limit that soreness that we were talking about, that eccentric-based soreness. The main thing, avoid no pain, no gain. Now this tool, called a foam roller, I don't know how many of you heard of it, but in my sports medicine practice, it's pretty defined that if you're an athlete or if you've been involved in athletics for any length of time or you have a gym membership, you know what a foam roller is. The other half of us don't know, which is fine, because what I'm here to tell you right now, get a foam roller. It is the best thing since sliced bread. This device, as you can see, it comes in many different shapes and surfaces. Obviously you want to be a little more advanced when you're doing this one. Those are soft, believe it or not, but they dig into you. And this has some panels. I've used that one before, and that grabs a little bit more. But for the most part, you can go to Target and get this one here. Very smooth. It comes in either a 2-foot length or a 4-foot length. And $20 for the 2-foot length, $40 for the 4-foot length, and it'll last you forever. And not stealing thunder here, but Sharmi is going to talk about how to use it. And I highly recommend it. Matter of fact, I think you could even use it as a form of exercise. I've seen people shaking their heads. I mean, if you've used one, it's something that's interesting about it. I find that I use it every day, twice a day. I use it in the morning and in the evening. And I don't have time to exercise 5 days a week. So if I get in 3 days, I'm happy. And I find that, and again, I'm not doing a full hour. I'm doing maybe 20 minutes, 30 minutes at most. And that foam roller in between, it's amazing how well it keeps me flexible, how well it gets rid of soreness. It's a wonderful tool. What it's doing is it provides, and the term I'm throwing out for you, it's called myofascial. If you haven't heard this term before, you're hearing it now. It's a very common term in sports medicine and physical therapy, and it's the myofascial release. The muscles have the capacity to regulate themselves, if you will. I talk about muscles having an off and an on switch, and you can basically stimulate that and get a muscle to relax very nicely just with the use of this foam roller. It takes just minutes to use. I'm serious. I use it in the morning. And at night, it takes me 1 minute. 1 minute, 2 minutes most, and I'm done. And I feel great. It's like a little cheap buzz. And as again, we'll get into this with Sharmi's talk, but you can use it for the upper body. This is the way I use it, where on my hip. I recommend that you, if you're to do it, make sure it feels good when you do it. If it hurts, then you're doing it wrong. Don't put your entire weight right on top of an exposed bony prominence. That's going to hurt. But you can turn and twist and find spots where it's not. And just let it roll. And just roll yourself back and forth on that, and you're in for some pleasure. It's a nice feeling of release. It's a massage. If you aren't sure about how to use it, if you're familiar with YouTube, it's amazing. I just had a patient of mine tell me today, he said, yeah, I couldn't believe how much is out there on foam rollers, on YouTube. He says it exploded. And then, of course, seeing a physical therapist. So that about brings me to the end of my time.
Thank you, everybody, for coming this late on a Wednesday evening. We really appreciate the support. My slides are not as funny as Dr. Zonner's, disclaimer, but my goal is basically to educate everybody on basic warm-ups and stretching. Since he has already touched base on why we should be exercising, I'm going to focus on the pre and the post of exercises. So let's get going. We're going to have some demos over here for the foam roll stretches that Dr. Zonner is a huge fan of. So we want to make sure everybody knows how to do them. Warm-ups. Warming up basically prepares your body for any kind of aerobic activity. A warm-up gradually prepares your cardiovascular system, increases blood flow to your muscles, raises your body temperature, and basically reduces muscle soreness and lessens your risk of injury. A proper warm-up routine is very important to your health and performance of the human body and basically injury prevention. So now we're going to talk a little bit about stretching. So now there are two types of stretching that we do. One is static stretching and something else that we call dynamic warm-ups. Let me tell you what the basic differences between the two and then explain which one is better and which one is not, or which one is appropriate for the situation. So static stretching, it's basically defined as a stretch that you're holding for 30 seconds to 2 minutes. The basic goal of a static stretch is to elongate the muscle to improve your flexibility. So now if your trainer or your physical therapist is telling you to hold a stretch for a certain time, there is a reason. We're talking about flexibility and we want to make sure that specific muscle is getting elongated. Static stretches help to reduce injury by maximizing flexibility and improve biomechanics. The goal, again, is flexibility. Now, dynamic warm-ups. Dynamic warm-up is basically a series of movement that is designed to increase the body temperature, activate the nervous system, increase your range of motion, and prepare the body for the aerobic workout or any kind of sports that you're doing, for example, running, soccer, martial arts. A dynamic warm-up basically uses stretches that are dynamic, which means that you're moving as you stretch. Now, the basic difference between a static stretch and dynamic warm-ups is when you are doing a static stretch, there is a nerve receptor in the muscle spindle, basically. It's called the Golgi tendon organ. What happens when you're doing a static stretch is there is no receptor that is going to the brain, which is telling your muscle spindle that there is a stretch happening. So the body responds by doing a relaxation. Now, before going for a workout, for example, if you want to run and you're doing a static stretch and your body's responding to relaxing, you don't want the muscle to be relaxed when you're preparing yourself to go run. So dynamic warm-ups have become a very big thing in sports amongst running groups, biking, anything that has any kind of dynamic activity. We are working on dynamic warm-ups. There is actually enough research and evidence showing that dynamic warm-ups actually prevent muscle injury as compared to static stretching. Now, does that mean static stretching is not good enough? No, it's just done at different times. So if you want to stretch a hamstring, you're going to focus on your static stretching, which means you're going to hold that stretch for 30 seconds because your goal is to stretch that muscle. But if you're preparing to go, for martial arts or your Zumba class or body pump or whatever, they the instructors these days are focusing more on dynamic warm-ups, which means you're actually moving while you're stretching, which kind of dampens the response of your Golgi tendon, and hence your body is actually not completely relaxed, but it's preparing itself for a workout. But now we're going to talk about foam rolls. The white ones is what we actually use more in our clinics, and the spike ones where it says most intense, we try to be nice to our patients, so we don't want to cause too much pain, hence we go easy on them. But you know, the spiky ones are fairly painful. So we're going to do the first one, which is a hamstring stretch. As you can see, the weight is on the upper body, and she's just going to go back and forth. So the goal here is to make sure you're stretching your hamstrings. Just be careful with your upper body. If there's too much weight on the shoulder and the elbow can start hurting. So make sure your arms are close to your body. Another modified way of doing this is maybe bending one knee. So there we go. So your weight is just on one leg, and then you're just going back and forth. Similarly, we're going to do the calf stretch. So the foam roll is just going to go further down. Again, be careful with your upper body. You don't want to hurt your neck or your wrists when you're doing this. And if you want to do a modified, go ahead, bend one knee for me. The next one we have is, the back. So this actually, as Dr. Zonner was saying, you can use this as a workout. This is actually working on your core, just doing this movement here. So go for the lower. There we go. Hands behind your head. There we go. Just roll. Use your feet. There we go. Yeah, you feel it. She's getting a workout. All right, so this is a pec stretch. This is for everybody who uses a computer. Like everybody, everybody. And this feels really good. This is actually probably not as painful. You know this one, right, Abby? Mm-hmm. Okay, butt on it. There we go. Neck on the, there we go. Keep your knees bent. So see, your core is engaged because you need to stay on this. We just saw that. Don't roll off.
Don't roll, okay.
Hands up here. There we go. Just both hands slide up all the way. Oh yeah. See, now she feels good. Both hands all the way. There we go. And bring it down. Bring it down, nice and easy. Bring it down all the way. So this is going to stretch your pecs, to everybody who sits like this all day. All right, let's do the quad stretch. So there are two ways of doing the quad stretch. In the image, you can see she's on her elbows. If you want a deeper stretch, you can go on your palms. So with the foam roll for the lower body, just make sure you're not hurting your shoulders and your neck while doing it. So just, keep your arms as close to your body as possible so you're not here and engaging muscles that you don't need to. Perfect. Let's do the IT band. That's their favorite. Both. They love it. Which one? Which side? Right. Which hip? Left? On the elbow. There we go. So it goes from the hip all the way down to the knee. So if you're having knee issues or hip problems, this is like the best stretch ever. This is just a basic roller that we have. So if you feel like, your quads are tight or your IT band is tight, instead of, laying on the floor and rolling, you get these rollers in the store now just to, up and down, back and forth. That way there's not a lot of body weight on it. You can decide how much you want to push, and it's easy. Again, you get spiky ones, which we don't have, so. I'm just going to give you a little information about strength training. Basically, you don't have to be in shape to get started, but you do need to start to get in shape. So what is strength training? Actually, I have some examples. I've just given you some very basic back and core exercises that you could do safely at home. Again, as Dr. Zonner said, if there is something that you need to check with your doctor, please do. This is just, just some basic guidelines or some basic stuff that you can do without any equipment at home that I have over here. So you have the bridge, which is fairly safe. Then we have the single knee to chest, which is also fairly safe. I have the whole time, I have the starting position, end position, and how many sets that you need to perform. Then we have the basic planks. If basic planks are too much, you can always go on your knees and hold in the modified plank position. Then we have the modified push-up, if you don't want to do a regular push-up. And then we have the Superman. So these are some basic exercises that I wanted to give everybody just to maintain a healthy back and a healthy core. Then we also have a legacy strength training program that there's a service the rehab center provides. And if you need to know further, we can provide some more information. That was a part of my talk.